30-year-old female presented with complaints of unintended weight gain, hoarse voice, difficulty in swallowing, and decreased appetite. Physical examination shows painless enlargement of the thyroid gland. There is bradycardia and hypotension. Okay, now all these features are already suggestive of hypothyroidism. Her mother also suffers from similar complaints and she has a history of vitiligo. Okay, which of the following laboratory results are consistent with this patient's condition? Number one, clinical features are suggestive of hypothyroidism. Okay, now what are the common causes for hypothyroidism? The most common cause is iodine deficiency followed by Hashimoto's. Okay, now what could this be? Is it a case of iodine deficiency or Hashimoto's? Nothing is suggestive of iodine deficiency in this case as such, right? They have not reported about the geographic location of the patient to say that, okay, it is a hilly area and patient may be consuming food low in iodine. And nowadays, because in countries like India, where there is fortification of salt with iodine, iodine deficiency is becoming less important cause, and Hashimoto's is becoming the leading cause, even in hilly areas. Okay. And then the second thing is, when you say Hashimoto's, we know it is an autoimmune disorder, and generally, right, you might have heard me saying this repeatedly, there is usually a clustering of autoimmune disorders. Like when you say Hashimoto's thyroiditis, there is also a chance that the patient may develop diabetes mellitus type 1, which is again autoimmune disorder, might develop vitiligo or alopecia areata. This clustering of autoimmune disorders. In this case, right, patient has family history, plus patient has family history of vitiligo. Now, keeping all this in mind, right, I'm already going ahead with the diagnosis of Hashimoto's. So this is most likely a case of Hashimoto's thyroiditis. Okay. Now, how do you make a diagnosis of Hashimoto's thyroiditis? In Hashimoto's thyroiditis, thyroid gland is under the inflammatory attack by the lymphocytes and it loses its function. It can go through a transient phase of hyperthyroidism followed by that persistent hypothyroidism, right? So it is the thyroid gland which is dysfunctional, which is not able to produce hormones. So in that case, right, what will happen to T3 and T4? T3 and T4 will be low because the thyroid gland is not able to produce. Now, what will happen to TSH? Because the thyroid gland is not able to produce, the pituitary will sense it and it will start increased production of TSH. TSH will be increased. If you look at the TRH, even that would be increased because pituitary also should know that the TSH production should be increased. So TRH and TSH will be increased, T3 and T4 will be decreased. Okay. And then this Hashimoto's is due to both antibody mediated and cell mediated immune injury to the thyroid gland. So there is CD8 positive T cells which are causing the damage, and B cells are producing antibodies. Which antibody is most important? It is the anti-thyroid product peroxidase or anti-TPO antibodies that will be positive. So in Hashimoto's, you will have anti-TPO antibody positivity. So now which fits the option here? You are expecting to see elevated TSH, right? Low T4 and anti-TPO antibody positivity. So that makes option C as the correct answer, right? So that's it from me here, guys. Thank you.